Hi, welcome back to Rebel Health. I'm Dr. Ellenvora, a holistic psychiatrist based in New York City, and today I want to talk about stigma in mental health. Of course, the olden days, there was a stigma. It was like to be depressed, to see a psychiatrist was like a moral failing. It was something to be ashamed of and to talk about in a whisper. And over the last couple decades, we've started to move away from this. And there's been a spirit behind the idea of less stigma in mental health care, where we talk about it as a disease. It's a biologic issue. It's like diabetes, and you wouldn't be ashamed of having diabetes and taking your medicine for that, right? So why would you be with mental health? And I think that the spirit of that is kind of good, right? It's to take away some of that stigma and that really inappropriate and just wrong idea of mental illness as a moral failing. But what happens instead is that it's trying to help people feel more comfortable engaging with mental health care, accessing mental health care. And I think what ends up happening when more people feel comfortable accessing mental health care is actually just more people end up medicated. So my hope is that even better than just decreased stigma and more access to mental health care is kind of more access to better ways of thinking about mental health. Right now, we really only have one system in this country. It's if you're depressed or anxious, then you go see a therapist or a shrink and you get put on meds, or maybe if you're lucky, you get into some good CBT or good therapy. But that's kind of the extent of our creativity around mental health. We're not thinking about the way you eat impacts your mood, or the way you sleep, or your sleeping habits, or whether or not you're exercising. Sometimes some people are kind of progressive and saying like, hey, you should try exercising. It's better than any antidepressant, but it's usually not the first thing we're looking at or reaching for. And we're certainly not sufficiently emphasizing things like community and relationships and access to nature and sunshine and fresh air and all of this. So yes, decrease the stigma, and yes, completely drop the idea that this is a moral failing. But don't just say that the right next step is for everyone to feel comfortable accessing mental health care and getting on meds. And I think that's really just every once in a while the right time and place for that. But overall, most of us can be addressing our mental health before even ever getting on meds by just getting our health into balance and getting these components that are important in our connections and our social life, getting that squared away where we actually feel grounded in community, doing meaningful work, getting enough rest, enough movement, and enough nature. Most of us are actually back to feeling like ourselves. I hope that's helpful. We'll see you next time on Rebel Health.